usually 4 hours, but you will also be sleepy in that time as well. So there's not much time left until you start drinking again.
Yeah.
So don't worry. That's not that hard. And you decided for tummy tuck surgery, as I remember. I'm gonna make some markings in a short while and take some pictures. But before that, if you have any questions to ask or need to answer, I can gladly do that. Anything about the aftercare or anything about the surgery itself. So any questions you might.
Oh yeah, how big is the scar going to be?
Probably a bit longer.
Yeah.
I will try to limit it. But I mean, usually the tummy tuck scar goes to the sides.
Yeah.
If there is much excess tissue, then the scar goes longer. If there is less excess tissue and gets shorter, that's usually the deal. But nevertheless, it will be under your underwear, so you will be easily hiding it. So don't worry.
That's
about it.
alright, yeah.
And of course, there will be a small scar around your navel or belly button, but
Yeah.
that's very hard to see after the healing is done.
Okay.
So, because I have to carry belly button as well to its
Yeah.
normal place.
Okay.
The surgery will take around 3 hours. That's a rough estimate. It may take longer, maybe shorter a bit. It's not about time, what we are here for, it's about the result.
Yeah.
So I'm going to try for the best result, but usually it takes 3 hours.
Okay.
You're not going to notice it because you'll be asleep. You will spend 2 nights here, tonight and tomorrow night. I'm going to see you and then discharge you if everything is fine.
Yeah.
You will have a garment when you wake up on you,
Yeah.
or a special bandage. I will see the best
Yeah.
inside of that, and you're going to keep it for 3 weeks.
Yeah.
That's a minimum. You can have it longer. It's up to you, but 3 weeks is mandatory from my point of view. It will help limiting the amount of swelling after the surgery. Usually there's going to be swelling no matter what we do, even with garments, but that limits that amount significantly. There will be a drain, which is a plastic tube basically designed to take the fluid and blood out of your tummy to the outside. So it helps with swelling, it helps with pain related, and makes the healing a bit faster, so to speak, and it's not going to cause any pain to you. It's just a tube, you're going to see it.
Yeah.
And probably I'm going to take it before you're discharged.
Yeah.
Very, very rare, I have to leave it a couple of days longer, but that doesn't mean you have to stay longer in the hospital. You can go with the drain if necessary to the hotel.
Okay.
We'll see. I mean, it's just info,
Precaution.
but most commonly I take it before the discharge,
Okay.
the day of discharge. For the first couple of days, let's say 3 to 5 days until your departure, or so you can put it that way, I will ask you not to stand in complete erect posture, or in fact you need to bend forward a little, not much. You don't have to do like that,
Yeah.
but when you stand up and walk, please bend a little forward.
Oh,
Get that stretch.
yeah, I walk like that sometimes anyway.
Yeah.
Yeah, that's
So
all.
that's to protect the stitches,
Stretch.
because it's going to be tight, you're going to feel it, and to protect it, that's the best posture for the first couple of days.
Yeah.
Even though you're inside the garment, still that will be helpful.
Okay.
The
stitch is dissolvable?
Yes, you don't need to go anywhere for them to be removed,
Okay.
but it takes a while, a couple of weeks. What else? For heavy activity, heavy exercise, lifting heavy objects, you have to wait also 3 weeks. That's also a minimum. And then you will start gradually. I mean, you can resume exercise after 3 weeks, but it's also individual. If you don't feel like it, you of course have to wait a couple more days. But most commonly, patients after tummy tuck surgery resume as soon as 3 weeks is over. So, what do you do for work? Is that?
I'm a student nurse.
Oh, okay. So do you have to like carry heavy objects or?
Now,
Yeah.
I've got placement on the 9th of December, but it's in the ED department.
Mm-hmm.
So, like, I won't have to lift patients or
Okay.
wash them, I won't have to do none of that. So it's alright, really.
Okay.
I'll just be doing blood pressure and stuff like that.
Yeah, that's fine.
Yeah.
Okay. Anything else?
Anything else, Ina?
So how soon after, obviously, once the anaesthetic's worn off, will you get to sort of mobilising? Is it the next day?
No, today.
Same day?
You should start walking today. The
That's
nurses
good.
will help you, and you have a company. That's also a good news. I mean, if you are not very weak or if you're not very dizzy, etc. So it's the best for the healing that you start walking today.
Yeah, that's
So
fine.
it shouldn't be much. I mean, it can also be just inside the room, but
Yeah.
getting up and walking a bit really helps, especially with lung functions. I mean, you're a nurse yourself, probably you also know some
Yeah.
of this info. So you will start walking today.
Okay. And when I'm better, can I eat what I want?
Yes, of course. I mean, it's all about what I'm going to do is just actually very superficial, just under your skin. So I'm not going to go deeper inside to the organs, but it causes sometimes delay in bowel movements, etc. So I usually recommend that you eat food what you know, like nothing new. Don't try experiment with new food these first week. So no food which causes bloating to you. I mean, you know, which are risky nutrition. So try on the safe side. Drink plenty of fluids like water, etc. Even though if you do all of them, sometimes constipation may be evident in the first couple of days. Then let me know if it's still so after 3 days. So I'm going to give you also medication in that case. But other than that, yes, everything is fine. You're fine. Constipation, nothing at all. Of course, you can eat whatever you want.
Oh, that's right then.
All she's worried about
So
is
you're
eating
planning-
and drinking.
Yeah,
You're
I like because I eat and drink of what I like.
Uh-huh.
And my friend, she had it done at a different place in Turkey, and they said she has to eat special diet. Oh, I don't want to eat special diet.
The only thing I recommend as a special diet is that you take plenty of fluids and water, especially like 2 liters minimum, and nutrition is rich in protein and green vegetables. That's healthy
Oh,
eating.
I'll
That's
be
nothing else.
alright then, yeah.
Yeah.
So,
Yeah.
don't go just on carbs. So take because you're going to heal with them. I mean, the medications I'm going to give you is not just for taking your pain away and protecting you from microorganisms, but the main element of healing is what you eat. So that should be protein and vegetables for
You
all
love
the vitamins.
Yeah,
So
you
that's
love
nothing new, good. New news to you. So it's
Yeah,
just
that's fine.
basic knowledge.
Yeah. Anything else, Dina?
No,
I think that's it now.
Okay.
What time will we going now?
As soon as possible, of course. I'm ready. I'm waiting for the OR. So probably 20 minutes maybe. So
Oh, that's all right then.
not much. So
Okay.
you don't have to wait longer
Yeah,
without
that's
drinking.
good.
I just want to go sleep now because I hate being awake, thinking, oh, I can't eat, I can't drink.
Any piercing you have, or like earrings and metal objects?
Yeah, but you know this, can you put a plaster on it because it's new? So if you take it out, it's going to close.
Oh, okay. Then yeah.
Can
I
we put a
understand.
plaster on that one? Do you want
Okay.
to take this one out? This one's plastic.
If plastic, no problem. The other one, okay, just
Yeah.
one. So on your left ear.
Yeah,
Okay.
this one.
Okay.
No more.
Okay. If no questions anymore, then I will proceed with the pictures and the marking
Yeah, that's fine.
place.
You want me to get up?
How do you feel, Natalie?
I feel excellent.
So, do you recommend Meditravelist?
Yes, I do recommend Meditravelist. Very good, they're very helpful, and I'm very pleased with all my results, and I will come back again.
Bye, Natalie.
Yasmin, I'm a little bit sad.
Yeah, I'll miss you.